Then good morning, good day to everyone. Welcome to our panel. It's the perspectives on drug policy. We have three speakers today. We have first is Carla Rossi. We're having a little difficulty with Carla's sound, so I'm not sure if she's connected to well or not. We have Ben Shear, and we have Elisa Greer from SFU. When we come to the speakers, I'll get them to introduce themselves and go from there. We hope to have a Q&A at the end, depending on time, how that goes. Otherwise, there is a chat feature at the bottom. You can use that during the session and ask Q&As also in the bottom, and I will chime in and direct the appropriate question to the speaker, probably towards the end, but I'll judge that as we go. So with that, I will, Carla, are you with us? I'm just, for some reason, we can't get Carla. So you may have to sign out, Carla, and sign back in, and sign back in directly into Zoom if you can, and in the event that you're using the app, and we'll go from there. But I would suggest, Carla, you sign out and then chime back in, and I'll keep an eye and go from there. So perhaps we'll start with Ben then. Would you go ahead, Ben?
Cool. Sorry, one sec. Okay. So the share screen feature, I'm just trying to find that. Sorry, Alyssa, do you know where the share screen feature is? Sorry, I'm just trying to.
It should be at the very bottom, Ben.
Yeah, the center.
Oh, yeah, there you go.
Bottom. Oh, Carla is.
Oh yeah, Carla's with us now. So okay. Carla, we're just going to change the order a bit. Ben's going to go ahead now, and then we'll come to you next.
Okay.
Okay, go ahead. Now share screen is bottom, and if you click on those two boxes, the optimized video chat and share sound, you should be good to go.
So I'm ready. I just need to change something in my settings. Carla, would you mind going first? Sorry.
Oh, yes.
Thank you. Thank you. Sorry about that.
You're on mute, Carla.
So I can't hear you, Carla. It wouldn't be a Zoom session without technical difficulties, am I right?
Oh, yeah, there we go. I think she's with us now, so we're all good.
Can you hear me now?
Yes, that's good. We can hear you now.
Okay, but I can't find how I can use my presentation, my slides.
Okay, at the bottom of the screen, there's should be a box. On mine, it's green. It says share screen. The very bottom, somewhere along the bottom. Do you see that?
Okay.
You know, if you click on share screen, your presentation should come up. Oh, there we go. It's coming.
Okay.
Yes, that's good. And now you just start. You can start your presentation. Or
okay, can I start?
Yes, you can. Go ahead.
Okay, thank you. I'll try to be short. Anyway, I would like to show some results of European project that include also Canada and Australia as countries that analyze the social outcomes of the different illicit drug policies, laws and policies. And in particular, we applied a quantitative analysis of the different laws that I call prior evaluation of the law, that is called leximetric approach. The leximetric approach analyzes the different articles of some law and provide the scores for the different consequences of the articles. And this allows to compare different countries, but also in the analysis that I can show different period of the approach to drug law in Italy. And we use the leximetric score to give the leximetric analysis to give scores to the different laws with respect to drug users and drug dealers. And then we compare the prior evaluation of the laws and policies with the posterior, the consequences, in particular using some indicators as mortality, morbidity, and criminal actions, and also some new indicators, in particular some new indicators that relates to polydrug use and polydrugs dealing. We have three laws in Italy, one before 2000 and in the before 2006. So the first one we consider now between 2000 and 2006. A second law that is much more severe and repressive between 2006 and 2013, and another one now since 2014. The first law indeed was is since 1990, 2006, but we consider just some indicator in this period. And the typical articles are Article 75, that is related to consumers. And in Italy, there is some depenalization that means that consumers have just administrative penalty. And then we consider Article 73, that is considered to push to dealers, small dealers. So the leximetric score for Italy have a specific scale that is a scale between 0 and 5 for administrative penalty, and a score between 5 and 10 for the criminal sanction. So this part regards Article 75 for consumers. This part, this scale regards Article 73 for dealers. You see in this slide the different, say we consider in the article the consumption of soft drug, of hard drug, the cultivation of soft drug and hard drug for personal use or for dealing, and also the sale of soft and hard drugs. And here are the numbers, so the score that we gave. You see that the dealing essentially is always the same, more or less. But we have different situation in the first law. This is the second law, the more repressive, and also in the third. But we can see better here. If you go to the level of repression to consumer and to dealers, you see that the first law is in some sense nice law in some sense, because you have lower for consumer and for dealers, lower repression for soft drug and higher repression for hard drug. In the second law, you have the same situation for consumer and for dealers for soft and hard drugs. And in the third law, you have something that is in the middle, because the situation for dealers is the same as the first law, but you have not the same situation for consumers, because you see here that the law remains more repressive for consumers, the third law. And here there are some comments. The part very strange of the second law is the fact that all drugs or substances are considered equal. So there is no difference if you use or sell soft or hard drug. So the consequences, for instance, with the length of prison for dealers of heroin or cocaine is the same as for cannabis. And the same is for personal consumption. A situation specific for personal consumption is something that relates what was used before. If you were called because you were fined with some substances, you could avoid to have administrative penalty at accepting to go in some kind of therapy. But then, since the second law, and this remains also in the third law, you cannot avoid administrative penalty even if you want to go to enter in therapy. So this is a problem because in some sense, the secondary prevention is no more used. And the fact that you consider all the substances equal with respect to the penalties administrative of criminal is something that is quite scientific, because at least in Europe, we use a lot the results published by Th9 and Van Amsterdam, that is also now included in a report by the Global Commission on Drug Policy, that also the policy should adapt and should be related to the different consequences for what concern health of different substances. Now we have already seen the leximetric scores of the three law in Italy. Now we go to see what are the consequences of these three laws and compare the consequences with the prior evaluation. Well, I can see the last column. Well, let's see. You can see all the tables. The complete table can be seen by you.
Yeah. Hi, Carla. Just you'll only have about another 3 minutes or so. If you could.
Yes, I have just 2 tables.
Perfect.
But
Thank you.
I cannot see the last column because I see all of us over my last column.
Oh, I see. We see a column that says, I think it says law 79, 2014.
Anyway, I show how I construct this table.
Yeah, okay.
We have in the first row, we have the different total score of the different three law. So we have 36, 40, and I can see the other one. Okay, if you see the last column, you will see that the other one is something that is close to 40, should be. It's strange that I, you, and all the others are over the last column. It's different to comment. Anyway, we put in the first row, then you can read yourself. In the first row, the scores, the leximetric score for what concern drug dealers. And then this is the leximetric evaluation. And the other are simply the consequences. So the prevalence of person in prison for the article on dealers, the percentage of person in prison, and the National Statistical Institute which estimate the market with the Eurostat method. And then we have two new indicators that takes in account also the estimation of the workers in the market. So the market was at risk of entering in prison for the article related to dealers. And you can see that the second law, that is the most repressive, has the higher consequences, so the higher social cost. The same happens for the users. Here you see the same indicator. This is the score, the leximetric score of the law for users. And then you have the consequences that are evaluated on the usual indicators, so the change in annual incidence in therapeutic public services, change in annual prevalence, etc., and also the average social cost, and also the polydrug use indicator, that is a new indicator that takes also into account the different consequences on health of the use of different substances, and also of conjunct use of different substances, so the polydrug use. And this allows to, of course, say that also using the social indicators, when we put higher score, higher leximetric scores on the different law, we have as consequences also higher indicators, as we use standard indicators, or if you use new indicators, in particular polydrug use, or the average number of market workers at risk of entering jail.
Now, Carla, I'm sorry I have to interrupt.
Yes.
You've come to the end. Yeah.
I wanted to arrive exactly here.
Okay, good.
What there are some examples of indicators in the slides that you can see if you are interested.
Now, and I remind to all the attendees that they can also ask questions either on Q&A in this session.
Thank you very much for the attention.
Yeah, thank you very much. And people can, or attendees can ask questions or follow up with comments on the Whova app later as well if they have questions. But we're going to move now to Ben, who is a master's student at the University of Waterloo in the UK. Carla, I'll have to get you to end your sharing your screen.
Yes.
Okay, I can do that. There you go. Ben, over to you.
Hi there. So my name's Ben, and I'm currently, I work for a homelessness charity in London. And this research was from my master's at the University of Waterloo, which was in Canada. And although I don't sound like it, I actually grew up in Vancouver and I've spent my whole life there. And so, yeah, this is research that I conducted in my hometown. So for the past kind of 2 decades, overdose deaths have steadily risen in British Columbia, specifically in Vancouver, and we can see that trend continues to rise, even though stats aren't fully made up for 2021 yet. Based on kind of the averages, it looks like it's going to be even higher than it was last year. And when we look at the map of Canada, if it was updated to 2021, it would be kind of similar in terms of the distribution, and British Columbia is by far the most heavily hit, and a large percentage of concentration of that is in Vancouver. So the reason for this influx over the past kind of decade, 2 decades, has been the introduction of fentanyl, which is an extremely strong kind of synthetic opioid, which is up to 50 times stronger than morphine. So it's becoming increasingly hard to measure out correct doses of opioids when people are either smoking or injecting. As a result, we're seeing kind of much higher levels of overdoses, and up to 85% of all overdose deaths in Canada contained fentanyl. And so now they're parts of Canada where people are getting heroin, they think it's heroin, but it's actually just pure fentanyl. So as a response to these alarming numbers, the Canadian government, both federal and provincial governments, have implemented various forms of harm reduction policies. So needle exchanges, overdose prevention sites, kind of education, and most notably supervised consumption sites. And Vancouver has a very high concentration of supervised consumption sites compared to the rest of Canada, especially in the downtown east side. There are 4 supervised consumption sites. There are 10 needle exchange programs, and I believe there are 6 overdose prevention sites, which are slightly less regulated and a bit more kind of peer run, and they're also temporary, so they can be stopped by government, as opposed to consumption sites, which are a bit more permanent. So the location of the research that was conducted was in the downtown east side, as you can see here on the map. It's much older, much poorer, and also much more kind of ethnically diverse than the rest of the city. And this is especially apparent in comparison to the surrounding neighborhoods of the Financial District and Yaletown and Gastown, which are some of the wealthiest postcodes in the country. So what were my research questions? So due to the heavy concentration of both police and public health services in the area, I was interested at looking at kind of how these services are experienced. What is the lived experience of public health and policing interventions? How do the practices of police and of public health agencies shape the lived experience and the perceptions of the community? And if anything, what is lacking in the current approach to policing of drug users in the downtown east side? Sorry, I skipped that one. So so the methods that we used for my study were qualitative and ethnographic in nature. And so I spent 4 months conducting ethnography out of a supervised consumption site in the downtown east side. It was situated within a community center that had other services, so showers and kind of ID clinic and health services. And so people would come to this center not just for the consumption site, but it was, so that was a big part of it. I had 15 semi-structured interviews with staff and focus groups with 30 service users of the consumption site. I also analyzed VPD documents in the archives, just to look at kind of the evolution of policy within the VPD. And then following all of this, I thematically coded the transcripts and the research to kind of pull out trends within the research. So on reflection of kind of the interviews and all of that, Foucault's notions of power really kind of stood out as being present within what community members were saying about both public health and policing interventions. There are specifically two forms of power. So I won't go too much into this because it's not kind of the point of what I want to get into in this, but biopower is basically how states and government can control the behavior of people by focusing on health. And so by promoting health and healthy health practices, they can control other sorts of behaviors. And then disciplinary power is a form of power which is enforced by various institutions, so schools, military, police, hospitals, and that is kind of controlling certain behaviors due to the fear of punishment by the community or by citizens. So they'll behave in a certain way due to the fear of punishment. So central to this idea of disciplinary power is surveillance. And so in order for disciplinary power to work on a daily basis, community members need to feel like they are constantly being watched, even when they may not be watched. So for example, when someone's driving, they won't speed because there's a fear that there could be speeding cameras. So they'll kind of regulate their behavior in that way. And as we'll see, this came out a lot in the testimonies of the community. So I'm looking at supervised consumption sites and community policing practices, and what are the power relations within these two settings, and what are the similarities and differences between the two. And kind of Foucault's frameworks really brought out the similarities in both of those. So first we have the panopticism of supervised consumption sites. So this is basically feelings of surveillance, constant feelings of surveillance. So the way that supervised consumption sites are kind of ordered, a lot of the time there'll be a central nursing station that can see all of the injecting practices at the same time. So users are feel like they're being watched while they're injecting, which is kind of promotes safety, but also kind of promotes certain injecting practices. And then there's also the fear that kind of, even though it's supposed to be a safe space, police are sometimes called, rarely, but are sometimes called to the vicinity if there are disruptions. And so you can see here from the quote by Matthew, it says, "The staff are always watching," and I mean, it's not constant, but they're definitely on speed dial, as in the police. And so you can never actually tell when they're going to watch or show up. So like I said, in community policing in Vancouver, there's a team called the Beat Enforcement Team, and that's there to enforce a heavy police presence within the downtown east side. So to react kind of in the case of crime. But as it came out in the interviews, it's also being used in a slightly different, maybe more kind of perverse way to enforce constant surveillance upon community members. And so this came out a lot in the interview. So here Cal says, "I mean, the police are everywhere here. They're usually parked out front of places, often with nobody in it. But that makes people think twice about punching someone in the face when they see a cop car sitting there. You never know when they're going to walk out and catch you." I think a lot of the times that's how they utilize their resources. It's intimidation. So again, here evoking kind of feelings of surveillance and intimidation in the policing practices. Brandon here talks about kind of more visual aspects. So yeah, it feels like there are more cops now than ever. When you drive around over the Canby Bridge and you see all the cops, just look down at how many cop cars there are. I've never seen something like that before. So Brad, I don't do anything to get in trouble, but they still just want to follow me. I just don't like it when they're sitting there in their car and they just stare at me. If you have a problem with me, come up and talk to me. I'm human. Don't just sit there and stare at me. And so the rest of the focus group at that time kind of agreed and said that they'd had similar experiences on a pretty daily basis. So even though these experiences that I speak to kind of seem on the surface as predominantly kind of negative and invoking feelings of intimidation and surveillance, I'm not necessarily saying that they're necessarily negative, because they do achieve certain outcomes. But I think that it's really important to kind of acknowledge what is the byproduct of these policing practices. And there were also a lot of kind of positive interactions and instances that were spoken, even though it was predominantly negative, there were still a lot of positives that were spoken to about the community. So here we can see Michael again, saying, I've been homeless in the alleys for 2 years, and I interact with them several times a day because they're driving through the alleys, and they often stop and look at their screens, and obviously they get all the information about me, but then they take time to talk to me, you know, they're concerned. So I feel a lot of compassion from them. I know as a community, the relationship is negative, but from my perspective, it has been positive. So I think that last...
Ben, I'm sorry, you got a couple of minutes now.
Yeah, that's perfect. Thank you. So I think that last quote is really important, just because it does show that when there's kind of more of a kind of a community building approach taken, and police do take time to speak with community members and kind of get out of patrol cars and talk with the community and try and build up those relationships, that is positive, and it is reflected by community members when that does happen. I just think that there needs to potentially be more of an effort to kind of take on practices such as that. I also think kind of this presentation in general and the paper that I published on this speaks to the importance of policymakers looking at power relations within the decision-making process regarding policy, and how they can kind of take information from the community and listen to the community and empower the community as much as possible in the kind of the decision-making process around policy in general. Yeah, so yeah, thank you very much for listening, and if you have any questions, I'd be happy to kind of answer at the end or via message. Thank you.
Thank you very much, Ben. We'll then ask Dr. Lisa Greer, Associate Professor in School of Criminology at SFU, to present. Thank you.
Thanks. I'll just get my slides up here. Can you see me there? Hopefully.
Yes, you're good. Yeah.
Okay, great. All right, thanks so much. I think this is a great presentation to follow Ben's, because it's also based in British Columbia. So yeah, today I'll be presenting on some research that we did just this last year in British Columbia, which is a qualitative study on perspectives on simple possession enforcement and decriminalization among police officers in British Columbia. And today I'm presenting on behalf of myself, Naomi Zakimi, Amanda Butler, and also Sarah Ferenz up at UBC, who helped with the analysis. So Ben sort of talked about this already, but to give you a bit of an insight into the context and background of the study, BC is in the wake of a overdose crisis, and it's been exacerbated by the advent of COVID-19. So to give you an idea, there's been about 1,700 deaths in 2020, and our monthly rates of overdose deaths in 2021 are not getting much better. In this context, the criminalization of drug possession and law enforcement practices are really under a spotlight. There's been various models of decriminalization, including depenalization, police diversion, and full decriminalization that have been put forward as potential alternatives to the current legal framework of prohibition. And we've seen support for decriminalization actually across all levels of our government, including the Canadian Chiefs of Police, the Provincial Health Officer, Dr. Bonnie Henry, and Vancouver City Council. So this support for decriminalization is especially in response to evidence that prohibition isn't working. So for instance, we know that police officers' presence in drug markets leads to riskier drug use practices and reduced access to health services and social services. We also know that police presence at overdoses has been a main barrier to people calling 911, even though we have Good Samaritan drug overdose laws here in Canada and elsewhere. And we also know that the relationship between people who use drugs and police can be contentious. People who use drugs report high levels of stigma, discrimination, and inconsistent use of police discretion. So with all of this, the role of law enforcement and our current drug laws with regard to simple possession are really under scrutiny. And police officers themselves are deeply implicated in our drug policies and our drug laws, mainly because they're the first point of contact with people who use drugs, and they're essentially the gatekeepers to our criminal justice system. Yet we don't really know a lot about how law enforcement has been translated in practice, particularly within this context. So how are officers responding to the evolving sociopolitical and health context in their work, and how do they actually feel about drug law reform? So the aim of the Canadian drug laws study was to examine people who use drugs and police officers' experiences and views towards enforcement practices, including officer use of discretion around simple possession offenses. And I'll be presenting on the data from police today. So we used a qualitative research methodology, and from July to October 2020, we did one-on-one phone conversations with consenting police officers from the RCMP and municipal departments across BC. So we talked with 16 officers. These conversations were really rich because we used purposeful sampling and did concurrent data analysis, and we focused on a wide range of perspectives. We did a very collaborative thematic analysis and developed a coding framework together. And then we actually took the findings back to people who use drugs, police officers, and legal professionals to validate the findings. And today I'll be presenting just on part of our findings from these interviews. So I'll be presenting on the themes of attitudes towards decriminalization, simple possession in practice, and simple possession as a tool. So first off, we asked police officers about their perceptions towards decriminalization, and officers were mostly supportive, but this did vary by officer and geography. So in more rural areas in British Columbia, there was more conservative views towards drug use, and so less favorable attitudes towards decriminalization. Officers shared different benefits and concerns that they felt towards decriminalization. So some of the benefits included really related to their jobs. So they talked about the opportunity of like getting back to real police work and more of quote unquote what they signed up to do. And Naomi actually presented on this in her panel 2 days ago about officers just wearing too many hats and being pulled into more social and health roles. And so decriminalization was, again, a way to get back to real police work and what they signed up to do. They also saw that decriminalization might be a way to support reconciling relationships with the community and no longer being seen as the enemy or being pitted against people who use drugs. And then they saw decriminalization as a way to focus resources on addressing drug-related harms and the added benefit of destigmatization, which they really linked to maybe preventing overdoses. As we know, stigma is really related to overdose. But then they also had some concerns with decriminalization. So they were concerned about whether drug law reform would address, quote unquote, the real problem of addiction. And they were concerned with what services or supports would be in place. And even if this was part of the conversation in drug law reform deliberations. So, and they were particularly concerned with access to treatment. Officers were, the next theme that I'll be presenting on here is simple possession in practice. So we did ask officers about their experiences in this, and they were asked to share the different ways that they were enforcing simple possession. So some officers shared that they thought that decriminalization was sort of already a thing. They thought that, or one person said, you know, we decriminalized drugs 25 years ago, we don't enforce this anymore. But this really ranged across the province. Other officers talked about, I arrest people daily. And so there was really a patchwork of depenalization across the province. We also asked people if they were given directives to stand down in the sense and asked not to arrest or to really use their discretion. And while they used a high degree of police discretion in their work, much of their discretionary practices were actually being influenced by the Crown or prosecutorial practices and policies rather than directives from police departments or organizations. And then our findings also showed some of the harms from a policing environment that really relies on police discretion. So first of all, officers were still doing a lot of drug seizures and destroying harm reduction equipment. and spoke about some of the harms from these practices, such as increased crimes among those having to replace their drugs, and increased overdose risk among those who were in withdrawal and having to replace their drugs quickly. And then there was a real focus on drug trafficking. So a lot of officers had shifted their focus from simple possession charges to trafficking, which really villainized the dealer. And officers treated dealers and people who use drugs as sort of mutually exclusive groups. But as we know from the literature, these are often the same people, and more marginalized or street level user dealers often bear the brunt of this type of law enforcement. And then finally, the last theme that I'll present on today is this idea that police officers use simple possession as a tool. So officers talked about working in a depenalized environment, but they still used simple possession in their everyday practice. And simple possession functioned as a mean to accomplish several different things. So first of all, it functioned as a way to, for officers to arrest and seize drugs and gather evidence, build a case, and obtain leads as part of ongoing investigations, usually related to drug trafficking. Secondly, simple possession was used to charge offenders in cases without sufficient evidence in other criminal cases, such as drug trafficking. So officers use simple possession as sort of a lesser charge to at least get people on something, if they couldn't charge them with other things. Or they use simple possession as a way to compound charges in cases where there were really harsh offenses, such as assault. And so this was a way to really like throw the book at them and get them, serve as much punishment as they could. And then finally, simple possession was used to intervene in the lives of people who use drugs. So street patrol officers in particular talked about enforcing simple possession to address public disturbances and street disorder. And so they were using simple possession as a way to arrest people to get them off the streets. And because officers were using simple possession as a tool in a variety of different ways, they were worried about what this meant in terms of discretion if in the event of decriminalization, and what other tools might be available to them. So it's just some basic conclusions. So what does this actually all mean? Some of this research highlights some of the potential harms from our current model, as well as alternative models if we don't take the time to look at the specifics. And it raises several questions, such as is a depenalization model, or sort of this patchwork of depenalization that we see here, is this really working? We see that it's inconsistently applied, and we know that marginalized groups face the brunt of this type of policing that we're seeing. Also, how does police discretion change under decriminalization? Police officers did speak about some of the benefits to full decriminalization, but they worried about what it meant for their jobs. And in particular, what other tools might be available to them in doing their work. And then finally, will the failing of other systems undermine any policy reforms, including decriminalization? So if we're talking about a model of decriminalization, such as police diversion or depenalization, we already have a failing system in place with respect to things like access to treatment, housing, and mental health support, which is currently really difficult for people to find. And so we need to be talking about those things as well. So in conclusion, if we have a real shot at drug law reform here in BC or other places, we need to be raising questions about the potential harms and models of decriminalization. I think because the devil's really in the details, and we can continue to learn a lot from the people who are directly affected by these policies and laws. And with that, thanks very much.
Wonderful. Thank you very much, Lisa. And if you do have any questions, we do have a few minutes, just a very few. And if you have any questions or comments, you can use the chat or raise your hand and I can acknowledge you. I'm just taking a look here, so nothing yet. I'll make a comment because I spent 35 years in policing, in the last 7 in British Columbia, and part of it was dealing with drugs and those areas. As an observation, you're quite correct that drug possession or simple possession was used as a bit of a tool for policing. Often it was, and it's important to note that the police haven't for years gone out and actively looked for people with simple, small amounts of drugs for personal use. It was always sort of incidental or secondary to dealing with someone on other issues like impaired driving or a disturbance, where through the investigation you discovered they had drugs. The whole idea of going out and actively chasing somebody for simple possession, and that was the case probably 40 years ago when they that actually was the case. Social norms and social views and values have changed a great deal, and you're right that the police have shifted with that. I'm still surprised that when I see the police are still out there actively chasing someone. They're arresting people daily. The other thing is that,
Oh, I think that it's really region specific. Like I think Ben could probably even attest to this, that in places like Vancouver and cities where they're more vocal and open about depenalization, we see this a lot less. But it's really interesting to see that it is sort of this like tool in their back pocket, and people can still use it if they want to.
Yes, absolutely. Ben, do you have a thought? You might have waved there a little bit. So that it surprised me, and I think there is some discrepancies, or not discrepancies, differences across the country as well. Say that in British Columbia, which is probably more open to the idea of decriminalization or even legalization, differs from the prairies or from other parts of the country. So, and you see that in the police response. We do have one question. I'll just pop up here and find out who we got, and it's John, and I'll allow him to. Oh, say I want to allow to talk. Oh, it keeps wanting to do that. Okay, I'm just.
There's also.
John.
Oh, there you go.
Yeah, I think he's there. So, John, go ahead.
Hi, good morning. I enjoyed the presentations, although I was a little late getting on board. But the question I have is, you're going to be faced with a generational shift in thinking in order to achieve legalization. It would require political consensus. So what knowledge could police use now in the course of their training or recurrent training that could enhance their ability to cope with the drug dependency issues in our communities?
Like, are you wondering what sort of education can we do with police to sort of promote depenalization, or what do you mean?
Well, I know where I'm a little off topic in a sense, but where I'm coming from is what are the educational needs of police officers in dealing with cultural matters, societal matters, as members of society, but as control agents within society.
Mm-hmm.
Does that make sense for you?
Yeah.
What
yeah.
skills?
I feel like that's sort of the $1 million question is like, how do we train a large police force who are, individuals on their own and come with a long history of their own and views of their own and values of their own. And how do we train them around issues around substance use and mental health and complex issues, and still ask them to enforce the law in ways that are more just and fair and respectful. That's a big question. I think it's the ideal, but how do you apply that? I think it also depends on jurisdiction or an even country. Like I know in the States, there's hundreds of different sort of districts and ways of training, whereas here in Canada, it's all provincially based. And so you might be able to train more uniformly across the province here, but that's a very different thing down in the US. I don't know if you want to add anything, Ben or Carla.
I think I'm going to have to unfortunately cut it short there, but I'm just going to remind all the panelists and the attendees that there is a Q&A and a chat function in the Whova app for this session, and you can continue to add to that and ask questions. after the session. It doesn't just end here. So, and then that sort of creates an obligation or a challenge to the panelists to keep an eye on that app and the Q&A and the chat and follow up. There's also an opportunity to contact each of the panelists directly. Very interesting discussion. Thank you very much, everyone, and hope you enjoy the rest of the conference. Thanks. Take care.
Thank you.
Okay, bye.